Hi everyone, this is Mr. Neil Wrighter, also known as the Wax Whisperer. Thank you for tuning into my latest video. So the patient who attended with a blocked left ear, they had an occluding soft keratin plug. Keratin is a protein that's found in the skin that lines the ear canal. It's a protein that's also found in our fingernails and hair. The ear canal and the outer layer of the eardrum, so the lateral layer of the eardrum has three layers. The one that's facing us, there's a thin skin layer. We call that squamous, stratified, epithelial, keratinous skin layer. Epithelial is the outer layer of skin. In the ear canal, we've got 5 layers of that. And squamous is just another name for the skin cells are flat in shape. You can get different shapes, sizes of cells. You can get cuboid cells, but these are a pancake shape, so it's a flat cell. Stratified means there's layers. So as I said before, there's 5 layers of that combine and make up this epithelial skin layer. And keratin is usually found on the outermost layer of the skin that's on the surface of the ear canal. And as the skin cell migrates from deep in of the 5 layers, the most deepest one, it slowly moves outwards to the outer layer of the ear canal. And as it does, it has less blood supply. All the intracellular fluid becomes, it's harder for the cell to retain that fluid, so the skin becomes drier, hence it dies and sheds. And when that fluid is lost, it's not retained within the cell, we get a buildup of keratin, which is a protein. Keratin is actually really useful because keratin, what it does, it acts as a UV barrier. Harmful sun rays from the sun that can enter the ear, this keratin helps to reflect it, so it protects the deeper part of the ear canal, the inner layer of the ear canal. In addition, keratin can act as a hydrophobic layer. Water is really bad for the ear, and if you get water in your ear, it can get lodged. You've got bacteria in the water. It's a perfect breeding ground because it's dark, warm and moist. And keratin is slightly hydrophobic, so if water does enter it, it can almost roll off the surface out of the ear. Now, in most people, this skin that I'm removing at the moment, as it dies and sheds, it moves sideways out of the ear like a conveyor belt. And then you get another layer of skin, and that dies and sheds, and that comes out of the ear. And underneath that, you've got another layer. So it's a continuous cycle. The migration of dead skin from the eardrum, because it all starts off with the eardrum, it's approximately 3 millimeters a month, if I'm correct. So the average length of the ear canal, if you round it off to 3 centimeters, so on average it takes 10 months for a skin cell that's on the eardrum to die and shed to migrate out of the ear. And as this skin dies and sheds and migrates, any wax that's sitting on the surface also comes out with the dead skin. So this skin is very important. Now, as we get older though, in some people, this skin, they lose the ability to migrate out to the ear naturally, and this is what's happening in this patient's case. This skin is just dying, it's collecting in the ear, it's forming a plug, and then this plug is expanding in the ear canal. If untreated, and if that was just left in the ear, you can then develop a condition called keratosis obturans. So keratosis obturans is a very severe skin plug that's lodged mainly deeper in the ear, the medial parts and near the eardrum. It's very, very difficult to remove. And this plug of skin can expand to a point where it starts widening the ear canal itself. It compresses against the walls of the canal and it widens it. So we're just finishing off now. We can see the eardrum nice and healthy, just some keratin, dead skin near the eardrum. It's a fresher layer, but this patient's a regular patient. We know this is going to come back. So I'm just trying to remove as much dead skin as I safely can. I don't want to cut or abrade the ear canal here because that can in itself cause pain and infection for the patient. So I'm just using a fine end gauge because we do get a bit of clarinetting with this type of skin. Clarinetting is when the skin violently flaps against the tip of the suction probe and it emits a very loud, high-frequency squeal. So I typically use a fine end when peeling skin because you get far less clarinetting, if any, actually. And look at that view. You can see the whole eardrum in sharp. There's some dead skin at the entrance here. I think I'm going to revert back to a full zone of suction probe here because you won't get clarinetting with this kind of skin that's on the surface and almost ready to come out. Apologies for the hair. So the patient hairs were the side of their face, and as soon as you go in with the suckers, although we did place the hair behind the ear, the suction probe itself does vacuum some of these hairs into the ear. So this hair is actually on the patient's scalp, and as I come out the suction probe, it will also come out. Patients that are hearing aid wearer, which also doesn't help matters because the hearing aid itself can push wax further in. or dead skin. It can halt the migration route of the skin. Just see, this is on the lateral posterior canal wall, just gently removing that. And this skin, over time, it becomes quite damp and soggy and mushy. You can see this skin here near the entrance, it's got a mushy consistency to it, because it will almost wilt away as it dies. And that's the patient's eardrum. I hope you enjoyed that video, guys. Take care.